Students are often reluctant to go to a professional service in the first instance and prefer to come to talk to you as a personal tutor. It's important to understand that they may have that reluctance to engage with the professional services, and they might want to have a conversation in depth with you. Maintaining the boundaries in that conversation are really important, and having a compassionate engagement will help them to understand that you do care, but it's about you being able to make the most appropriate referral to the professional support services that are available. And the danger perhaps is that you may want to go into more depth in analysing the problem, and that could lead to future difficulties in that relationship and the management of what the boundaries are in terms of your professional relationship between yourself and the student concerned.
I want to talk to you about support that might be available for you in your institution in relation to your counselling service. So generally speaking, the support that's offered in counselling services can be split into two main areas. The first area is what I'm terming as personal development. So a lot of counselling services offer a range of interventions around personal development. This can range from one-off workshops around mindfulness, a workshop around procrastination. One-off workshops tend to be offered by most institutions. The other area around personal development might be online apps, web-based interventions, and it's worth checking out with your counselling service which ones might be available. At the other end, there's more about reducing symptoms and what I call treatment interventions. They tend to be more of a one-to-one nature, so that's one-to-one counselling. Different counselling services might have a triage model, they might have an assessment model. There's usually some way of assessing need as to the severity of what students are presenting with. And then students are then tracked or placed in a form of one-to-one treatment, either with a counsellor, mental health professional, and in more severe cases, obviously they're referred on to secondary NHS services.
So students would have access, like any other member of the public, to GP services, and they should register with the GP local to the area that they're living. Some universities have a practice that's linked with the university, like we do in Sheffield, but that's less common. So generally it would be encouraging students to register locally so that they do have a GP surgery where they can access support. So that would provide access to appointments with a GP or nurse practitioner, where there could be consideration of a package of support, including potentially medication, consideration of psychological therapy, and advice on lifestyle and behavioural techniques that might be helpful. The GP could then refer on to IAPT, which is where we would access psychological therapy in the first instance. That would include access to groups such as anxiety management, low mood, stress control, workshops that are generally very well attended and are very good in offering practical advice and also peer support for people with those sort of lower level mental health difficulties that so many people struggle with. In Sheffield, we have formed a specialist in-house eating disorder clinic to help students that are having difficulties with eating disorders, because we found that that was something that would be helpful for our patient population. So there might be particular clinics in particular areas aimed at certain difficulties or groups of people, but the advice on how to get access to that would be through the general practitioner. So I think it can be really confusing for people to know where to first present for help, and sometimes it's difficult to work out whether going to the general practitioner or whether going to the health service or whether going to the counselling service is the most appropriate. And I think the main thing to remember is it actually probably doesn't matter as long as they're asking for help. And if it turns out that they're going to the wrong place or the less appropriate place, then they could be signposted to the appropriate place. So I think the key is ask for help wherever. But if we're trying to work out which situations would most appropriately go to the general practitioner or the general practice situation, it's probably if you need a more broader approach to the care. If medication might be required, then you'd need to see the doctor. And also if you're thinking that there may be requirement for ongoing referral. So a kind of broader approach, whereas the counselling service is if you really feel that counselling is likely to be the most appropriate outcome, and possibly if that's the only outcome that's expected, rather than a wider discussion about what else might be useful. So the way appointments are accessed in different health services would vary. In a lot of places, initially people might be asked to have a triage appointment with a nurse, or sometimes they might book directly with a GP. But then the types of questions that would be asked of the student would be, how are they feeling? How's the way they're feeling affecting how they are living day to day, whether that's socially, academically, is it, affecting their sleep or their ability to, eat regularly, enjoy things, socialise. And so it would be trying to collect information to piece together a picture of how the student's feeling and how that's affecting them in their day-to-day living. Usually also we consider behaviour and lifestyle changes, so helping to support the individual in small changes that they can make that can contribute to them feeling better psychologically and having an improved sense of well-being. So often things like exercise, healthy eating, help with sleep difficulties or sleep patterns, encouragement to engage with hobbies and interests and social contacts so that they have a positive routine and a good balance, and we're avoiding long periods of time of not doing much and having the opportunity to dwell on difficulties that they might be facing. I think probably the main piece of advice that I would give to personal tutors if they're faced with students with difficulties with their mental health is to remember the boundaries and to remember that sometimes it's more appropriate not to be asking detailed questions and to becoming too involved, and that doesn't indicate a lack of care or a lack of understanding, but that actually it's often appropriate to be signposting and helping, supporting people to accessing the support from the right places, from clinical staff who've got the right training to be able to provide the right advice and information. So I think sometimes less is more in terms of trying to be the one person to offer that support. But if you've been the person that the students come to, then obviously that's a really good start, and it's important therefore to have the right information to be able to signpost the student to the correct support services.